Good evening, everyone. Thank you. My name is Karina Christensen, and I'm a soon-to-defend PhD student in health policy and management, 2 months. Thank you. I am honored and excited to welcome you here for an evening of celebration, a celebration of the Bloomberg School and 100 years of its extraordinary accomplishments from Baltimore to Bangladesh. Most importantly, we are here to celebrate a new vision for the future of public health. We have planned an extraordinary evening in an extraordinary venue, Montgomery Park. Wasn't the reception space amazing out there? It's really nice. Just like our school, this space has its own fascinating past, present, and future story. At the turn of the 20th century, Montgomery Ward ruled the retail world. In 1925, around the time the Wolf Street building was settling in, the company built this structure to support its retail business. Today, this property has been adapted for offices and events and incorporates environmentally sustainable design. And so we come to our celebration here tonight, surrounded by history. History here in Baltimore, a history of its communities, and the history of a visionary who saw a new way of doing things. We celebrate the work of our founding dean of the School of Public Health, William Henry Welch, a visionary scholar, leader, and administrator. I am the beneficiary of visionaries Sylvia and Eddie Brown and Sid and Helene Lerner, people who have committed themselves to allowing scholars like me ask important questions. Through their philanthropy, I am both a Brown Scholar in Community Health and a 2-time Center for a Livable Future Learner Fellow. With their support, I have been able to work towards making my public health vision a reality. Speaking of visionaries, it is my pleasure to introduce our host for tonight. It's not me. A man whom all of you know, but whose accomplishments bear highlighting. He's a global leader in public health and medicine. His scientific contributions in the fields of epidemiology of kidney disease, hypertension, and cardiovascular disease. He is a relentless advocate for issues ranging from autism research to road safety. Since taking the helm of the school in 2005, he has continued to elevate the school as one of the most influential institutions in the world. Under his leadership, the Bloomberg School has maintained its #1 rank among schools of public health and experienced tremendous growth in research, enrollment, and global outreach. Personally speaking, I admire Dean Clagg for his sincere dedication to the city of Baltimore and to his leadership for advocating transformative solutions to public health problems. Through his example, we students understand that the work of public health is also the work of advancing racial, class, and gender equity for all people everywhere. Our goal is not just to save lives, but to heal and transform communities, to create the conditions where life and health can flourish. Please join me in welcoming the Bloomberg School's 10th Dean and our #1 alum, Dean Michael J. Clagg.
Thank you so much.
Thank you.
You did a great job.
Thank you.
Thank you so much. Well, tonight is a once-in-a-lifetime night, and only that it's only guaranteed if you live 100 years. Like Karina, I'm delighted to welcome everybody to this celebration of the Bloomberg School Centennial. I'm especially honored to have in attendance the trustees of the university and of Johns Hopkins Medicine, members of our Health Advisory Board, academic and administrative leaders from across the university, and many of our donors, as well as alumni, faculty, staff, and students. We also welcome our partner organizations from within Baltimore and beyond. It's a special honor to welcome Mike Bloomberg, a public health hero and the patron of our school, as well as Patty Harris, the incredible CEO of Bloomberg Philanthropies. So I see Mike and Patty are arguing about who the applause was for, So Patty's team has worked tirelessly alongside ours to make this a very special event. Thanks, everybody, for being with us to help celebrate our 100th birthday. We began commemorating the centennial last July opening a series of more than 250 special programs and events that have been held all over the world. We both look back at our school's incredible heritage as well as look forward to the public health priorities for the future. You'll hear more about our history later in the program. And after dessert, you'll be receiving a gift. It's an advanced copy of a new book that will be released tomorrow by the Johns Hopkins Press. It's written by historian Dr. Karen Cruz Thomas, and it's entitled Health and Humanity. And it's the history of the Bloomberg School from 1935 to 1985. And we bundled it as a gift set with Elizabeth Fee's history that goes from the founding of the school to 1935. So please make sure that on your way out, you get to pick up your gift. This Monday, June 13th, is the real birthday of our school. It's the day that 100 years ago, William Henry Welch announced a gift from the Rockefeller Foundation of $267,000 to fund our school. And he established then the initial school of hygiene and public health. 85 years later, Mike Bloomberg made a visionary investment, and we became the Johns Hopkins Bloomberg School of Public Health, a name that we bear proudly. I now have the privilege to introduce the 14th president of the Johns Hopkins University, Ron Daniels. Prior to coming to Hopkins, Ron was the provost at the University of Pennsylvania, and before that, Dean and James M. Torrey Professor of Law at the University of Toronto. Since his arrival at Johns Hopkins in 2009, he has highlighted the global impact of our university, which has programs in at least 120 countries, while emphasizing the importance of Hopkins as an anchor institution here in Baltimore. He has articulated strategic goals for us and led us to be one university. Throughout his tenure, Ron has emphasized Johns Hopkins' commitment to the city. More recently, in the wake of the unrest last year, he has sought to foster dialogue among government, institutions, residents, and to enhance and expand the university's commitment to our hometown. From day one of his presidency, Ron has demonstrated a deep understanding of and support for the mission of the Bloomberg School. I cannot imagine a more fitting person to lead our university during our school's centennial year. It's my pleasure to welcome President Ron Daniels to the podium.
You didn't say.
It's true.
And a member of the Department of...
I don't want to have a conflict of interest.
Okay. Thank you so much, Mike, and good evening to you all. I was just mentioning to Mike, but the most important credential that I have these days, that I was recently appointed to the Bloomberg School of Public Health in the Department of International Health, so International Global Health. So Mike, I'm all in. 100 years ago, William Henry Welch stands in front of the Hopkins community at commencement. He announces what was until that moment a closely guarded secret. Hopkins had bested Harvard in its bid to launch an unprecedented experiment in public health education and research. One might have expected a little pomp and circumstance to surround that event. But this is Baltimore. We do things differently. And here is what the Baltimore Sun reported about Hopkins' chances of beating our competition to the north. And I quote, "Johns Hopkins could put up no buildings or purchase equipment, and it had no money. With its big deficit staring it in the face, and with the state's appropriation cut down by the last session of the legislature still further weakening its chances of securing the new school, it had nothing to offer." This is the Baltimore Sun. The relationship we've had over the century has been complicated. It had nothing to offer. But I pause here because I think we all know that's not the kind of coverage a president, a dean, or a visionary philanthropist dreams about when announcing a transformative gift. But wait for it. The reporter continues, "Johns Hopkins had nothing to offer, but its reputation for doing big things, its high professional spirit, the standing of the men who do its work, and Dr. Welch And it was those things that won. Now, while Dr. Welch may have sealed the deal, the school's ability to live up to that reputation for doing big things would be put to the test, as you know, almost immediately. It's October 1918. The school has just officially opened its doors to students, and Dr. Welch, the nation's foremost expert on microbiology, has been enlisted by the U.S. Army to investigate a strange epidemic erupting across the nation, and returns from the field, indeed suffering symptoms himself. Within months, hundreds of his fellow Baltimoreans succumbed to the great influenza epidemic. Schools are closed by the authorities who cannot predict what will happen if children gather en masse. And at the Hopkins Hospital, 6 entire wards are filled with desperately ill patients. By the time that the pandemic subsides, more than 2,000 people in Baltimore will have lost their lives. Now, as historians have chronicled, an army of clinicians and public health experts, many trained by Welch, formed the bulwark against the disease. Faced with the epidemic's swift progress, Hopkins nurses and doctors fan out to communities across Maryland. Welch's proteges race against time to understand the basic pathology of the virus, while Hopkins' founding professor of epidemiology, Wade Hampton Frost, oversees the nation's effort to collect and analyze data on the disease spread. Indeed, work that continues today to lay the foundation for flu tracking that is still used by health authorities. In the next 100 years, the shape and form of this story will repeat itself again and again and again, from AIDS to Ebola, chronic heart disease to road safety, smallpox to waterborne illness. In all of these cases, the School of Public Health plays a major role in confronting these challenges and vindicates the school's reputation as the crown jewel of an institution devoted to doing big things. This is the school that did not redefine public health, it defined the study of public health, seamlessly knitting together theory and practice, basic science and fieldwork, research and teaching, national and global problems. And above all, the Bloomberg School, our Bloomberg School, remained firmly committed to the belief that advancing knowledge and serving others was more than a professional obligation, it was a moral calling. In short, the Bloomberg School stands as exemplar not only of what a great school of public health is, but also of what a great university should be. A place that asks the questions the world is most afraid to ask, a place that reckons with the answers no matter how daunting or complex, a place that calls on its men and women to gather data, to invoke principle, and shape policy in the service of building a vibrant, just, and decent society. For these reasons, at this moment when we are witnessing destabilization around the globe, when our politics are tainted or contaminated by base demagoguery on all sides, when too many of our neighbors and our neighborhoods carry the burden of persistent and entrenched inequities, this school gives all of us a strong sense of optimism. As it has for the last 100 years and will for the next, the Bloomberg School stands as a beacon of rational discourse, excellence, and humanity. And of course, in this venture, we are so lucky, so fortunate, so blessed to have the support of our great alumnus and dear friend, Mike Bloomberg. Entrepreneur extraordinaire, fearless public citizen, public health advocate, transformative benefactor, but most importantly, tonight in this room, a proud son of Johns Hopkins University. Now, Mike, I kind of enjoy torturing you while I'm up here because I know how much you hate this, having the spotlight cast on you in these moments. So you're just going to have to bear it for a second longer, because it is inconceivable that we would celebrate the centennial of this school without celebrating you and your affiliation to it. It should come as no surprise that this school inspires optimism because our namesake is such an important, indeed singular and formidable source of vision and inspiration on public health, on issue after issue in public health, from gun control to tobacco to obesity. Mike, you have set forth a data-driven, people-focused approach to life-saving policy changes. During your time as mayor, and indeed afterwards, you have put these ideas into practice, and I should say, thanks in no small measure to the quiet leadership and counsel of Patty Harris, and we're thrilled, Patty, that you're here with us this evening as well. But Mike, on behalf of all of us, thank you for enabling us to close the first century of the Bloomberg School with our gaze firmly set on an even greater second. To all of you in this room, our many friends and supporters, the school's leaders and faculty, and here, I should just pause for a moment to just note that it's unfortunate that D.A. Henderson wasn't able to stay, but we do have with us tonight 2 of the 3 living deans of the Bloomberg School, and between D.A., Al Sommer, and Mike Clegg, we have almost 4 decades of leadership from these 3 scholars, leaders. And I just asked the 2 of them, Al, Mike, if you could stand so we could collectively register our appreciation for what you've done. So, to all of you, thank you for being part of this school's storied past and its wonderful future. And as I stand here, I find myself, of course, musing on what that Baltimore Sun reporter I mentioned earlier might have to say if he were here with us this evening. And I feel confident he would once again declare our unique brand of audaciousness and talent to be the winning combination to serve so many so well in the next century of public health. We are so truly fortunate. We are so truly blessed to have this great school of public health at the very core of our university. To all of you, congratulations, and thank you for making us so much better. Now, to continue the celebration, I'd like to invite Sapna Kudchakar, who is a scholar. She is a Sommer Scholar, Assistant Professor and Director of Johns Hopkins Pediatric Critical Care Clinical Research Program, that's a mouthful, and is pursuing a PhD in Bloomberg's Graduate Training Program in Clinical Investigation, a joint endeavor of the Bloomberg School of Public Health and Johns Hopkins Medicine, to come here to the podium to deliver a few remarks. Again, enjoy the evening.
Thank you, President Daniels, and good evening, everyone. My program trains clinicians to be effective and rigorous clinical researchers, and being a Sommer Scholar has enabled me to focus on an area of research that is near and dear to my heart: improving outcomes for children hospitalized with severe critical illness. Thanks to the financial support of the Sommer Scholarships, a program established with Michael Bloomberg's support in honor of the school's 9th dean, Alfred Sommer, I can focus my time on asking important questions and conducting research to support my thesis. I had the good fortune of meeting Michael Bloomberg about 2 years ago in October. In fact, he gave me a special shout out as it was my birthday, and a big hug and a kiss on the cheek in the photo line as a birthday gift. Best birthday ever. Michael Bloomberg is a visionary who understands that supporting a single scholar's research can produce amazing results and spark momentum to make a significant difference. As he mentioned in a May interview with the New York Times, if we've got a problem, let's do something. I agree, Mr. Bloomberg. When we see a problem, we are all here to do something about it. Thank you, Mr. Bloomberg, for your vision. As the 108th mayor of New York City, you demonstrated profoundly what strong leadership can do for public health. Thanks to your tobacco control efforts and other initiatives, life expectancy in the city increased by 3 years. Thank you for all you have done to solve public health problems as an elected official, as a leader, and as a philanthropist. Thank you for your commitment to providing the financial support that allows the focused work of the faculty, students, and staff here at the Bloomberg School of Public Health to flourish. Thank you for shifting paradigms on a global scale to improve the quality of life for millions of people around the world. This evening, I am truly honored to welcome to the stage Michael Bloomberg.
Thank you. Thank you. Thank you. Thank you. It's a wonderful standing ovation for Sapna. Well, good evening, and Sapna, thank you for that kind introduction. Sometimes people say, when they try to introduce me, they say he needs no introduction. But I always say, go ahead anyways, I won't mind, actually. I am sure that this audience would love to hear about my life story, including how I was able to maintain a C average at Hopkins. The truth of the matter is I was always, in high school, in college, and in graduate school, I was the kind of student that always made the top half of the class possible. So most of the people in this room owe me a lot because you would have been down with me. Anyways, when I first stepped foot on Homewood campus back in 1960, I never imagined that one day my name would end up on a building. And when I left the campus 4 years later, I don't think any of my professors thought that would happen either. But seriously, it's great to be here for a centennial anniversary. And I would like to start off by thanking Dean Clegg and President Daniels for their leadership, and Patty Harris, who actually does all the work. If you want a grant for something, my job is to put the money into the foundation. Her job is to take it out of the foundation, so that tells you who you should call. Leave me out of it. Seriously, all of them deserve a lot of credit for the incredible progress that Hopkins has made in recent years in so many areas. Although I won't mention that the lacrosse team this year did not make the Final Four. President Daniels, what were you doing? Ron and his wife became American citizens this year. They were too busy reading the Constitution and not reading the playbook for the coach. Anyways, thanks to Ron and Michael's leadership, the School of Public Health, seriously, remains the #1 ranked public health school in the country. And yes, knowing the school is ranked #1 in the nation is great, but seeing why it's ranked #1 is really incredibly powerful and inspiring. And every time I come back to Hopkins and meet with professors and researchers, I always walk away amazed at the work that they're doing and full of hope for the future. And whether you're a supporter or a graduate or a scholar here, all of us are part of this wonderful school that is changing the world in so many ways to make it better for all the people. And I couldn't be more optimistic about the next 100 years. As a matter of fact, I would like us all to reassemble then here. Seriously, Hopkins has been at the forefront of the public health field since its earliest days. And I was with David Rockefeller at a 90th birthday party the other day. He's 101 on Sunday, but we were having a 90th birthday party for a friend of his. And we talked about the Rockefeller Foundation and its support. They funded 5 schools of public health, one of which was Hopkins back then. And look what's happened. They really have changed the world. But it's all of us that are taking it to the next level. Back in 1938, 26 years before the Surgeon General linked cigarettes to death, Hopkins actually made that connection. And since then, Hopkins has produced research that has helped reduce HIV infections by 1/3, removed arsenic from food, passed laws mandating infant car seats, and the list just goes on and on and on. And all of that work has really saved so many lives, and most people who were saved will never know the names of who they were, and most of them won't know why they were saved. But the bottom line is, when we look in the mirror at night, we know we're making a difference, and that's what we've got to keep doing. And the scholars, yes, you can applaud for that. You know, the scholars and the graduates of this school aren't in it for the glory, and certainly not for the money. They're here to make a difference, and what a difference they are making. There's nothing more meaningful and nothing more satisfying than saving life, and that's what makes public health such an important and rewarding field. I remember when I was chairman of the board following Jeff Aronson, or two before him. Pam is here someplace, so we've got 3 chairmen of the board here. Al tried to explain to me that it made an awful lot more sense to prevent people from getting ill than to spend our time trying to mop up afterwards, and it's a lesson that I've always tried to tell other people. Public health really makes an enormous difference in this world, and that's why it is a big focus of Bloomberg Philanthropies, and Hopkins is always the first place that we call when we're looking to challenge a societal issue. Over the years, the school has helped us find new ways to fight global tobacco use, obesity, gun violence, malaria, road crashes, and prevent child drownings. And these problems are often overlooked by governments and by philanthropists. But in each of these areas, by working together, we really are able to prove that it's possible to make a very big difference and save an awful lot of lives. Al Summer, Dean Clagg's predecessor, serves on the board of the Bloomberg Philanthropies, our foundation. And he, as I said, is the one that got me interested when I was chair. And when I was elected mayor of New York City, I called Al and said I needed a health commissioner. Who do you recommend? And that's how I hired Tom Frieden, who now runs CDC and is making a big difference as well. Of course, my political advisors weren't thrilled exactly when Tom suggested we ban smoking in bars and restaurants. And after we did that, after we adopted that law, when I was doing parades in New York City, I got a lot of one-finger waves. But today it is phenomenally popular. No restaurateur or bar owner would turn it back. And it has become so popular that basically all of Western Europe, all of Latin America, most of North America, and even into Beijing, people have smoking bans on where you can smoke, and that makes a very big difference. And they're also raising taxes. When I left office back in 2013, people often asked me, what was I the most proud of? And it's tough to come up with anything that is more satisfying to me than the increase in life expectancy that Sapna mentioned. 3 years increase in life expectancy. In New York City, life expectancy is 2 years greater than the average across America. So if you would like to live a few years longer, I cannot guarantee every one of you will if you move to New York City, but on average, I can guarantee that. Let me talk a little for a second about philanthropy and what we can do to be part of saving the world. Some people wait until they die to give away their wealth, but I've never understood why you would deprive yourself of the chance to see all the good that money can do. And the chance to help others is one of life's great rewards, and something my parents taught me at a very early age, and that's why I've always supported Hopkins, whether I had any money or not. The Alumni Association claims, I have no recollection of this, but they claim that I first made a donation after I graduated of $5. Do I remember it? No, but if you look back, if I did give it, it was at least a bit, and $5 might not sound like much today, but it probably was enough for a fancy date back in those days, at least by my standards. Over the years, I've been lucky enough to be able to give a bit more. And I can tell you that I've gotten more back than I've given. It's hard to put into words the feeling that you get when you see your life's work, life-saving work being done for you, and helping make possible people to be able to raise their family and have a future. And that's the feeling that I get every time I come to Hopkins. And I bet it's a feeling that a lot of you have as well. So thanks to everyone here. Hopkins is positioned to be a leader in public health for the next century. And who knows, maybe a Hopkins research team will come up with some of the health interventions to keep all of us around for that next centennial, as I said we'd like to do. But no matter what, the extraordinary work being done seriously at Hopkins will continue to make a world a better place in so many different ways. And it will probably, I think, be one of the things that we'll all look back on for the rest of our lives. So congratulations to everyone who has been a part of the first century and let's hope that the next century is even more successful. When you look at yourself in the mirror tonight, just before you turn out the lights, you should have a smile on your face, because all kidding aside, you are making an enormous difference, and we have made enormous progress in this world. In the last 40-odd years, we've cut poverty in half around the world. Today, more people go to bed with a meal in their stomach, or fewer go to bed without a meal in their stomach, fewer go to bed illiterate, fewer go to bed without a roof over their head than probably ever before in history, and part of that comes from the Johns Hopkins School of Public Health. God bless.
Thank you, Mike. Oops, sorry. It says Ron Daniels. Let's see. Okay. Thank you, Mike. So, you know, as a dean, it's wonderful to have a wealthy philanthropist give you a naming gift. But when you have a naming gift from a wealthy philanthropist who's a public health hero, who is arguably the most enlightened elected official ever in terms of public health, that's even more special. And Ron, thank you for your kind and eloquent words. I had not cleared with the general counsel whether I could mention you were a faculty member in our school, so I was concerned about a possible conflict of interest, so I didn't mention it. So, but as I reflect on the most significant moments in our school's history, obviously, number one is the gift from the Rockefeller Foundation that, you know, based on the Welch-Rose report and Welch's ardent advocacy for our school, that we won the gift to be the first independent graduate school of public health. But more than anything, I think that what makes us the incredible institution we are today is the transformational generosity of Mike Bloomberg. And in collaboration with the Bloomberg Philanthropies, led by the incomparable Patty Harris, we have, among many other accomplishments, created a world-leading malaria research institute. And we're fortunate to recruit Peter Agre, a Nobel laureate, to head it. Established a new Department of Health, Behavior, and Society, led by David Holtgrave. Strengthened our Institute for Global Tobacco Control under Joanna Cohen. And under Adnan Hyder's leadership, prevented injuries globally. Please join me in thanking Mike Bloomberg for his contributions to our school, our university, and to public health here in Baltimore, in New York, and around the world. Thank you, Mike. And like Ron, I want to recognize my predecessors, Al Summer, we already got up, and D.A. Henderson was planning to be here, but wasn't able to make it. But it's, when you think about it, the three of us have led the school for more than a third of its history. It does make you feel a little old. It makes me feel a little old. But I've been fortunate to have Al as the very model of a gracious predecessor. He's been there every time I need him, and when I don't, he's never around. So. And DA as well has been incredibly supportive. I want to thank the Bill and Melinda Gates Foundation as well. They've been an incredibly generous supporter of our work and our mission to improve the lives of women, children, and families around the world. We're grateful to all our donors. Every gift has an impact. In addition, I want to thank everybody who made this centennial celebration tonight and since July of last year a success. We started the planning process, I say nearly 5 years ago, but actually when I became dean, it was pointed out to me I was in the year 89 of the school, and I thought we should celebrate the 90th. And I think Sylvia Eggleston Ware is over there. I went to her and said, Sylvia, let's do a 90th. And she said, we just did the 75th. So that's when I started planning for the 100. But 5 years ago, we kicked it up in the high gear, and there's been many people in this room who have been involved in that effort. But we're here tonight in large part because of the guidance and leadership of our alumna and dear friend, Margaret Kahn Himmelfarb. She has done so much over the last 5 years. I wonder if Margaret would stand up and be recognized. Okay. One of the key elements we wanted to incorporate into the centennial celebration has been to include our local and global communities. And one of the ways we did that was to launch an ambitious plan to have 100 centennial dinners around the world. We work in 100 plus countries. We thought it would be great to do that. But people told me we couldn't do it. Well, tonight is our 143rd centennial dinner. And we've held them in 69 cities, 35 countries, and 6 continents. And in January, a little late, we're going to have one in Antarctica, so we'll hit 7 continents. Yeah. The dinners have been incredibly effective in energizing our alumni, our friends, and the entire school community. And you guys are all adding to that energy tonight, and I want to thank you. A defining moment of every such dinner has been to have a toast to the school, to raise our glasses in honor of the school centennial. There we go. Hey, a glass appears. Yeah, so 100 dinners is a great thing, 143. It's good for the school, bad for my waistline. But please join me in celebrating the school's past, present, and future. Salute. Please enjoy dinner. Thank you.
Ladies and gentlemen, please welcome Summer Scholar Owen Brady.
Thank you, Samuel Norrie, the drumming group. That was excellent. Good evening, everyone. My name is Owen Brady. I'm a summer scholar, and I'm a doctoral candidate in the Department of Population, Family and Reproductive Health. My research focuses on health equity. And my experience at the Bloomberg School has shown me that it's necessary to prove to policymakers the measured impact of development and aid work, giving them tangible evidence of why they should put money towards projects that effectively target poverty. And as we envision the future, I'd like to share a brief recap of this afternoon's event, What's Next? The Future of Public Health. I think many of you who were at the Wolf Street building or who watched the webcast know that it was a remarkable event. And this is a school that thinks big, that pulls together nationally known writers to ponder the future. So thank you firstly to the moderator for this event, Julie Rovner, the Robin Toner Distinguished Fellow at Kaiser Health News, and former NPR health policy correspondent. Julie helped steer the conversation from one fascinating discussion to another. We first learned from author Sonia Shah about how pandemics arise, how they sweep across our ever more connected globe, and what we need to prepare for next. We heard from the New York Times' Yamiche Alcindor about the roots of social and racial justice issues and how they play out across the streets of America and afflict our communities with poverty, police killings, and trauma. We listened as NPR investigative journalist Laura Sullivan took us deep into our country's failure to care for the mentally ill. She spoke eloquently of what needs to be done for our most vulnerable citizens. Today's event reminded us the future is not for the faint of heart. It's up to all of us in public health to lead the way to a better future, to protect health and save lives, millions at a time. Our ability to lead the way is grounded in the vision and courage of those who came before us. Now let's turn our attention to the screens for a few moments to both reflect on the accomplishments of our past, which truly inspire our future.
He did go, the next year, to Baltimore, to Johns Hopkins University. He came seeking strength and guidance to one of the best known of all American schools. Was this class the road forward? Only time could tell.
In 1916, Johns Hopkins University established the world's first graduate school of public health. It was the time to train a force of public health leaders and to find solutions to the world's most pressing health problems. Since our founding years, the school's research, education, and practice have improved the length and quality of life for communities everywhere, protecting health, saving lives, millions at a time. Today, from milestones of discovery to steadfast dedication across its communities, the school remains unwavering in its purpose and passion. For more than 2 decades, we have been ranked as the #1 graduate school of public health, educating students from across the globe.
The Bloomberg School of Public Health is the oldest, largest, and most impactful school of its kind. We are indebted to our donors, alumni, faculty, students, staff, and friends for making our life-saving work possible year after year, decade after decade. Our past is only prologue. We will use this milestone moment to reaffirm and re-energize our commitment to leading public health into the future.
Our faculty conduct groundbreaking research in over 130 countries. 15 years ago, philanthropic support from Michael Bloomberg shifted the trajectory of the school into unparalleled directions, and in recognition, the school took on his name. Our alumni number more than 20,000, holding top positions globally, from the World Health Organization to the Centers for Disease Control and Prevention. Johns Hopkins Bloomberg School of Public Health stands at the forefront of discovery, teaching students from our home in Baltimore and across the world. As we look to the future, public health faces challenges and opportunities that did not exist even a decade ago. We are ready to confront the next emerging epidemic, toxic agent, or debilitating disease. Yet the basic tools remain the same as when Welch founded the school, using science and evidence to prevent health threats across populations.
From the United States to countries and communities everywhere, there are always new diseases that require our attention, and there are always public health challenges that require new approaches. Together, our support for innovative research can spur the solutions of the future, and that has the potential to improve billions of lives.
In the 20th century, life expectancy doubled worldwide. Since 1980, deaths of children under 5 have been cut in half. What's next? Another outbreak of Ebola, the spread of Zika. The giants who preceded us and those who walk our halls today have prepared us to address these questions. The Johns Hopkins Bloomberg School of Public Health brings hope and action to take on the problems of the future, protecting health, saving lives, millions at a time.
Ladies and gentlemen, please welcome back Dean Clegg.
Thank you. So I hope you enjoyed that film. The first time I saw that film, the first draft, there were so many pictures of faculty members from the School of Medicine, from the School of Engineering, because they were at our school teaching. I didn't recognize any of the faculty members. And although I like to celebrate, so I don't know where Ed Schlesinger is, but you saw the picture, of course, of Red's or of Abel Woolman, who we both claim. So I had to have them reshoot some of the videos so we could have some of our faculty in it. But I thought it was a good sign. It was a good sign about the kinds of collaborations that we have. So, during this year-long celebration, I've thought a lot about the history of the school, and I've often pondered what our first dean, William Henry Welch, would think of the school today. Would he have envisioned that we're the biggest school of public health in the world? Would he be pleased? He was an internationalist. Would he be pleased with the diversity of our school, where we have students from 80 countries? What would he think of the 800,000 people who we touch through social media? And would he have foreseen that just as he benefited from this relationship with John D. Rockefeller Jr., who he relied on for critical support and support through the Rockefeller Foundation, would he have seen that we would have that corollary with Mike Bloomberg and Bloomberg Philanthropies? And would he ever have anticipated? So for those of you who know the history of the school, it was called the School of Hygiene and Public Health. And Welch was a proponent of hygiene, but not public health, which he saw as more applied. What would he have thought when we renamed the school and renewed the school in 2001 as the Bloomberg School of Public Health? Could he imagine the impact that we have around the world? Our faculty, staff, and students work on projects in over 100 countries. And that impact is what's captured in our tagline of protecting health, saving lives, millions at a time. So you heard it several times tonight, you heard it there. But many of you know that motto was suggested by Mike Bloomberg. And it's easy to understand why it resonates. It's a succinct, insightful, and hopeful message about the impact of public health. And it reflects Mike Bloomberg's understanding of the power of public health. We're going to keep the tagline for the next century, but in truth, if one adds up all the lives that have been saved by vaccines and safe water, improved nutrition, malaria control, injury prevention, tobacco, just a few examples, the number, as Mike said in the film, would be much, much more than millions. It'd be many millions, perhaps billions. So we look to the next generation of public health researchers and practitioners to build on what we've accomplished to meet the challenges of the next century. So what's next for the future of public health? Protecting health, saving lives, millions at a time. I use these words a lot, and we return to them often because they do perfectly encapsulate our vision. They define the mission that's driven us from the very beginning of the school, perhaps not explicitly, but implicitly. And maybe even before the beginning. So an Institute of Hygiene in America, where did that idea come from? Well, William Henry Welch in 1884, when he was making the academic tour of Europe, was impressed as he toured Germany with institutes of hygiene. So it was back in 1884 that he first came up with the idea of having an Institute of Hygiene here in America. Today it's clear from our view of history that the science of public health has been incredibly powerful. It's scored great successes for human health. In the past 100 years, the CDC estimates that public health interventions have extended our life expectancy by 25 years. So think about that, 25 years. Typhoid, cholera, other diseases no longer sweep through communities in this country. Hospitals are no longer full of children with polio encased in iron lungs. With great research advances and evidence-based policies, millions and millions and millions of lives have been saved. Saving lives, millions at a time. We've done that. Our faculty, our students, our staff, our alumni have done that through safe drinking water, through micronutrient supplementation like vitamin A, through the eradication of smallpox, car safety seats. The list goes on and on. And although it doesn't sound like it tonight, I think we're in public health, we're pretty humble, right? Calling out our successes doesn't, it's true, we're humble. Doesn't come out, it's not easy for us. But reaching the centennial mark, the 100-year mark, is a time to be proud and to talk about accomplishments. And break glasses even. Okay. So, but even as we take pride in the past, we know that the future beckons. And it's exhilarating to recognize everything that public health as a field has accomplished and our school has done for humanity over the last 100 years. But what's really exciting is thinking about the future. What do the next 100 years hold? Our school was successful at its start and for the first century because the people who started it believed in and understood the germ theory of disease. They helped develop the new science of bacteriology, and they knew how to make vaccines. Infectious diseases haven't gone away, however. They're still with us. The challenge for the future is that we have to take on, at a population level, a host of newer and much more complex challenges. Non-communicable diseases like cardiovascular disease, cancer, and injury are now the leading causes of death around the world, even in the poorest countries. Solving these problems will require population-based interventions that change human behavior, that strengthen health systems, and enhance the coordination of public health with clinical care. There's no vaccine to prevent obesity, no vaccine to prevent mental illness or death from opioids. These problems are complex, and they require complex, multi-stakeholder solutions. That's a challenge of the future. How do we deal with the problems of the past and the present and take on these new problems of tomorrow? Well, we'll do it the way we've done the last 100 years. We'll do research, careful research. We'll create new knowledge. We'll educate the next generation of leaders. And we'll develop successful, creative, evidence-based policies and implement them. It's not going to be easy. Zika, antimicrobial resistance, diabetes, refugees, there are big and serious challenges out there. But look at our history. We've toppled bigger barriers to health. I'm confident that just as we led public health over the last 100 years, we will lead during the next 100. Public health is about safe, cost-effective interventions that are applied across entire populations, cities, states, nations, all regions of the world. It's powerful, but it's underappreciated. One of my colleagues says that public health is like the electric grid. No one notices it until the lights go out. Let's shed a little light onto what's next for the school. Another century of saving lives, millions at a time.
I'm Bethany Allen, and in August I'll earn my MPH and Master of Science in Nursing as a nurse practitioner. This may seem like an odd combination, the population-based focus of public health and the hands-on care of nursing, but for me, it's a natural fit. As a Peace Corps volunteer and later malaria technical officer in Madagascar, I worked with community health workers to combat malaria in rural and isolated villages. I loved the challenge of a system-based approach to address health. But there, and in other work as a citizen outreach director for a grassroots organization, I came across a lot of nurses, and I admired how they fought for patients in their communities. Nurses don't simply cure diseases, they care for patients. This means everything from addressing physical concerns to developing innovative healthcare delivery models that better support those left out by the current system. And that's what I want to do. So what's next for me? I will protect health by empowering individual patients while passionately advocating for equal access to health and wellness for everyone.
My name is Hugo Jun. I'm a Sommer Scholar and a PhD student in molecular microbiology and immunology. Tonight is all about successes, but I'd like to talk about a failure. As an undergraduate, I tried a couple of science classes and I didn't do very well. So I ended up graduating with a degree in theater and did my graduate work, thank you, in English literature. But science was still around and the promise of research kept calling to me. So at the age of 30, I decided to go back to school and I ended up falling in love with science. And now I'm studying a molecule that is essential for the survival of the malaria parasite. And I hope my work will eventually uncover some clues on how to stop malaria and prevent the deaths of millions. So what I've learned is that failure is a part of science. Without failure, you don't learn. And I've also learned that grit is a part of science because that's what gets you back up and back to work. So what's next for me? I will save millions of lives working on large-scale vaccine trials and global eradication efforts.
Good evening again. I'm Sapna Kachatkar. As a PhD student in the graduate training program in clinical investigation, every day I see children who have been in devastating automobile accidents and have endured extensive heart surgeries. I'm a pediatric critical care physician. For decades, our protocol has been to heavily sedate these children in order to make sure they don't remember their ICU experiences. Their eyes are closed, but are they sleeping? We all know that sleep is important for normal and healthy cognitive growth. We now know that simple interventions like early physical therapy, dimming the lights at night, and reducing the sound of machines in the ICU can help promote that restorative sleep that is so important for these critically ill children during a time of rest and recovery. So what's next for me? I hope to change paradigms in how we care for critically ill children in the intensive care unit and promote truly healing environments.
Good evening again. I'm Owen Brady, still also a Sommer Scholar. I'm a PhD candidate in the Population, Family, Reproductive Health Department. My path to public health began in the unlikeliest of places. I was working in the financial sector of Singapore as an actuary, so pretty unlikely to move from there to public health. But in my travels in the region, I visited some friends who were working in water and sanitation projects, and I was inspired by their passion and their commitment to their work, and also by the leadership shown by the people they were working with. And after that experience, it kind of inspired in me a career change to move into public health, and I spent the next 8 years working in maternal and child health, first in Malawi and then in Sierra Leone, before I moved to Hopkins. And in my experience working there, I was really struck by the inequities within countries in health, and my research now focuses on these health inequities and policies to overcome them. And in some of these countries, the chances of a child born surviving to their 5th birthday is hugely dependent on what part of the country they're in, and there are stubbornly unhealthy parts of country, and possibly stubbornly healthy parts of country like New York is now, apparently. But at the moment, income inequality is on everybody's lips. I think it's our responsibility in public health to draw attention to the health inequalities that exist in parallel with this, and I think represent one of the biggest challenges to public health over the next 100 years. So what's next for me? I will protect health and save lives by developing policies to reduce health inequalities, particularly related to child mortality in developing countries.
Darkest place, there's the faintest light, gives me hope to face the hardest fight. Pain delivers me. I don't need their sympathy, 'cause they can't shake away my might. Where I go, they will never find. Got to be stronger, reach up higher, must dig deeper, find the fire, feel enlightened, can't be frightened anymore. I can run now, so much faster, now defeat won't be my master, for to conquer my demons I won't. Survive. Too soon to run, too late to hide. It's my destiny, every pace, every stride. I am stronger, reached up higher. I dug deeper, found the fire. Feel enlightened, won't be frightened anymore. I can conquer my demons, I won't have to wait any longer. I am stronger. Now I'm stronger.
Thank you to our Somers Scholars for shedding light on the possibilities for the next 100 years, and to Peter Ferdort, who's a Baltimore High School senior, for his vocals, and Gary Adler on keyboard. Thank you. And I want to thank our young friends from the Henderson Hopkins School, Wolf Street Academy, and throughout the Baltimore community, and your parents for letting you stay out late. So now each one of you now holds a light. It's a symbolic gesture that we hope will inspire you to be part of our next 100 years. And in that spirit, we will continue the evening celebration with our afterglow. And I ask you, as we do that, to ponder what's next for you. Thanks for being part of our special evening and helping to celebrate our birthday. Good night.